Hi, I'm Ricardo, and I've been a registered massage therapist since 1998. I'm also a certified matrix repatterning practitioner and also a registered medical acupuncturist. And over the years, I've specialized in various manual therapy treatments, one of which is visceral manipulation. And my focus with the manual therapies has really been on the organ system of the body and how they affect the muscular system in terms of strength, and also the skeletal system in terms of range of motion, and regaining both strength and range of motion. Today I'm going to talk to you about visceral manipulation. In very simple terms, visceral manipulation is a very gentle treatment and therapy that is able to both assess a problem with the organs and also treat the organ system as well. And its main focus really is to deal with regaining movement patterns of the various organs. So there's something called mobility, the actual movement range of an organ, and motility, which is an inherent movement. We'll demonstrate today for you mobility. Why is it important? Well, sometimes we underestimate the importance of movement of various body organs, but to give you a sort of an extreme case is maybe when your heart stops beating, you're worried. Or if your diaphragm stops moving, again, we're very concerned with these things. So those are extreme cases because you know there's imminent danger ahead. But let's say we take, for example, the diaphragm, and we lose 50% of its movement, or even 25% of the movement of the diaphragm. What happens then? Well, if we think about what connects to the diaphragm, we have the heart above, we have the lungs that connect to it, we have the liver that connects to it below, we have various very important arteries that pass through it, that go to the abdomen, as well as the esophagus that feeds the stomach, and it even attaches to the front part of the spine. So it can have an effect on all these various components of the body. So it's very important that we treat it. Today I'm going to demonstrate, we've already done an assessment on our client, and I'm going to demonstrate the importance of movement, for example, in the uterus. So for many females, you may be experiencing painful periods, for example, and sometimes this is due to post-surgical interventions, so there may be scarring that may be involved. Sometimes there's cesarean sections, so that's scarring as well, but sometimes it doesn't have to be like that. So you may have a lot of uterine pain during your cycle, and for many years not being able to figure out where the cause of that is. So we've already done our assessment treatment, and it's a technique called a listening technique, and we are being able to assess various tensional forces in the body. And for illustration purposes, we've already determined that there is a decrease of range, and so when we're considering this, we'll get our client just to tell us how that feels. So we're just looking at movement right now. And what does that feel like when we're moving it to the right?
It feels different than from the left.
Do you experience any pain or tenderness involved there?
Tender, yeah.
A little tender, eh? And so we can tell that there's a little bit more range when we move it one way than the other. So I'll just quickly try to demonstrate trying to regain some of that movement pattern in there. So how does it feel, my pressure, now that it's on there?
Yeah, the pressure's fine. It doesn't hurt at all.
Okay. So this is a very gentle and subtle movements that occur. So we are changing various tensional forces in the organ. And again, we can think of what's connected to here. So we've got the bladder above, We have the rectum beneath the uterus. We have the sacrum, which is the lower part of the small of your back, you call it at times. So it can affect hip pain, low back pain, groin pain, sometimes even the front of your thigh. So there are multiple strain patterns and things that can be affected, especially with the various nerves and arteries that pass through this area. Okay, so I'm sensing that there's a tiny bit of a change that's occurred now. So I'll just retest even with this short demonstration and see if we've gained any movement differences in there, and whether or not we've lessened her symptom that she's just felt. But again, just be aware that these treatments take usually a much longer period of time. So just for demonstration purposes, we'll go back to the same area. Okay, and just be honest, tell me how this feels, and I'm going down to the same kind of depth.
It feels a little bit better.
A little better, okay. And you can see that's the same range, but look at this.
Yeah, big difference.
Big difference. So if you want to think about at the time of the month when the uterus engorges with blood, if there's no movement happening, there's going to be a lot of strain and of course pain that accompanies that. So this is one small example of how we're able to treat that kind of symptom, and also how we may resolve other symptoms that come along with it. So I hope that this demonstration of how visceral manipulation helps you a little bit in understanding how it works, and of course the far-reaching benefits of it, not just in one small area that we've shown today, but in many other instances where there are strains or fixed points in the body. Thank you for watching.